Welcome to Overland Park Regional Medical Center, a part of HCA Midwest Health. Today we're giving you an exclusive tour of the Pediatric Center. We'll look inside the pediatric emergency room and inpatient unit. Let's get started. The Pediatric ER at Overland Park Regional Medical Center offers access to a network of pediatric specialists and services designed to make children and their families feel safe and comfortable in an emergency. Some of the services include a playroom, board-certified pediatricians and pediatric specialists trained in emergency medicine, direct access to their pediatric intensive care unit if advanced care is needed, on-site pediatric surgeons and specialists, skilled pediatric emergency nurses and child life specialists, and state-of-the-art child-size equipment and technology. Now we're going to sit down with a few of the specialists that take care of the pediatric patients here. We have Dr. Gabe Schiffman, the Medical Director of the Pediatric ER, Dr. Eric Peters, the Medical Director of the Pediatric Intensive Care Unit, and Katie Overstreet, the Child Life Specialist. Dr. Schiffman, what are the benefits of taking your child to a dedicated pediatric ER versus a kid-friendly one?
So first and foremost, I think that if your child is having a medical emergency, they should call 911 and get to the nearest emergency department as soon as possible. But if you can opt to a pediatric dedicated emergency department, that is ideal. I always say that I don't go to a pediatric emergency department. I think kids should not go to an adult emergency department. That's if, in best situations. But the benefits of having a pediatric dedicated emergency department is that we have pediatric specialists who are dual board certified in the care of their specialty. They are much better equipped in taking care of pediatrics. We also have a dedicated pediatric nursing staff who are highly qualified in taking care of kids specifically. We also have child life specialists like Katie who have certification in addressing the concerns and needs of each kid on their developmental level, which helps the whole experience all the way around. We also have a neonatal transport team that's available, so if you do need transportation to our facility, we can arrange that as well to get you to the nearest facility to best care for you as soon as possible.
And how does a parent know if a child needs emergency care?
That's up to each individual family. So if a mom or a dad is concerned about their child, then that's on them, whether or not they think it's emergent to take their kid into the restaurant right away. I think that there's certain things that kids can get sick with. They can have illnesses, they can have injuries that all kind of will warrant medical care. It's up to each individual to decide if that child is having an emergency at that moment. I think some things that we worry about is any kind of difficulty breathing, persistent belly pain, vomiting that could have signs of dehydration, some deep wounds, injuries that can have deformity to extremities, so broken bones we worry about, any seizures, fainting, allergic reactions. Those are all things that are emergent. I think that a common cold with some sniffles or a low-grade fever, that may be able to be best to wait for their doctor the next morning. But again, every parent should make a decision when their child is needing emergency care.
Thank you, Dr. Schiffman. Now, Dr. Peters, what care is available to children who come to the pediatric ER and have a critical diagnosis or may need pediatric surgery?
Well, the pediatric ER is generally the starting place for most of our patients, and they do a fabulous job of getting most kids home. On some occasions, though, kids do require hospitalization. Luckily, we have a very nice pediatric ward, as well as Johnson County's only pediatric ICU to take care of sicker patients. And the people that take care of those patients are our dedicated pediatric nursing staff and a wonderful complement of pediatric specialists. That include surgeons like general surgery or orthopedic surgery, but we also have other subspecialists including neurology, gastroenterology, cardiology, endocrinology, and I'm missing several in that list. But it's a comfortable place to be. It's easily accessed, easy to get in and out of the hospital, and allows families to get their care closer to home.
Thank you, Dr. Peters. Now, Katie, what does a child life specialist do, and what benefits do you provide for the patients and their parents?
Well, the hospital can be a pretty scary place for children and their families. So us as child life specialists provide compassionate care, guidance, and support while they're here. We work directly with our pediatric population to provide developmentally appropriate preparation, education, as well as play to help normalize their hospital experience and help to take that fear out of the hospital.
Thank you so much, Katie, and thank you to all of the specialists here today for telling us about the services offered at the Pediatric Center. When your child is sick or injured, trust the pediatric experts at Overland Park Regional Medical Center to get them back to being a kid again. To find a pediatric specialist, call 913-541-KIDS. That's 5437. Or visit hcamidwest.com/pediatrics.